Good day, this is Dr. James Fortuin, and today I'm going to discuss an interesting ECG on this ECG of the week. Here's an ECG we received from a peripheral hospital, gentleman with chest pain, and we saw that this ECG had ST segment elevation and ST segment depression on most of the leads. There was no single cardiac area that was represented. Looking at the inferior lead, standard lead 2, 3 and AVF, you see ST segment depression, elevation, and on the chest leads one see that there's mostly ST segment depression. I was worried that there was a problem with the lead placement, and this picture just reminds us of where to put our chest leads. V1 and V2 left and right of the sternum in the fourth intercostal space. Lead 4 in your midclavicular line in the fifth intercostal space. 3 in between 2 and 4, and then 5 and 6 on the same level of V4 in the anterior axillary and mid axillary line respectively. When the patient arrived at Universitas Hospital, ECG was repeated, and here we clearly saw that he had an inferior myocardial infarction. On this ECG, it's striking that all the other abnormal ST segments, especially in the chest leads, is now disappeared, and he has elevated ST segments in 2, 3 and AVF, representing an inferior myocardial infarction. After treatment, ECG was repeated and patient ST segments went back to normal, chest pain improved, and we had one happy patient. The learning points in this ECG for me was, firstly, lead placement that is of utmost importance, and remembering that V1 and V2 should be in your fourth intercostal space. And this ECG also shows us that where the inferior segment myocardial infarction is represented on your ECG, standard lead 2, 3 and AVF. Thank you for your attention. Till next time.